Welcome back to another PCBH snippet. Now, this is a snippet that we're definitely going to make into a corner later on because there's so much to talk about. And that is specifically the role of being a behavioral scientist within a family medicine residency. And it's one of the things that my mind predicts PCBH does really well with because you get to work alongside residents like I do when I'm in clinic and also serve as a behavioral scientist within our family medicine residency program. Oftentimes, though, I get asked, hey, Dave, well, what's the most important thing to train your physicians on or your future providers? It's actually a question that we ask future postdocs. If there was one thing that you would train a physician or a family medicine provider on, what would it be? And for us at Central Washington Family Medicine, we have three primary goals that we want to train future physicians on. The first one is how to deliver care that is contextual, compassionate, and also person-centered. One of the ironies about medicine, as we know, is that just treatment adherence is difficult. And also kind of this idea of providing compassionate care is often seen as a nicety, that it would be nice if we could deliver care in a compassionate and contextual manner, but it's not a necessity. Where we actually look at and we embrace the research from compassionomics and also what the treatment adherence research kind of suggests, which is that it is paramount for providers to be able to understand the patient's context. That alone helps improve patient engagement, and then also provide care that is person-centered and coming from a compassionate lens. The second thing that we want to do is we want to train our physicians in how to intervene with things that might be behaviorally influenced. I can, and my mind beats me up about this. I get upset because oftentimes I think we maybe overprescribed a little bit for a variety of different things rather than doing what first line evidence informed treatment is, such as, helping people with blood pressure. Physical activity and exercise and diet changes are definitely recommended. The problem is, though, a lot of times we haven't given physicians the tools to use that, and the physicians are going to use the tools that they have disposal at, or they have at their disposal. So one of the things that we also try to do is make sure that we're giving education on how to effectively intervene through lifestyle, behavior, interventions, how to set SMART goals, how to teach mindfulness, how to come together and collaborate on a plan to make sure that they're going to be able to do their exercise routine and the diet changes, whatever it might be. And it's for all things related to behavior. Oftentimes, I think behavioral scientists, we focus too much on the mental health and the substance use, which is definitely prevalent within primary care and family medicine. However, everything that we ask someone to do, such as take a medication, that's behavior. And we got to make sure to upskill the physicians and the residents to be able to do that effectively. The last thing that we try to teach our residents is how to work on an integrated team. Another big irony of medicine right now and healthcare is that we're kind of taking all these professionals and everybody's kind of in agreement, team-based care is better, and we're just chucking them into a system and say, go out there, be a team and work together. We know teams don't work like that, though. We have to understand each other. We have to understand how to effectively work with each other, and particularly for our physicians, how to lead these integrated teams. So when we think about how we're going to impact our family medicine residents as become future physicians and leaders of healthcare systems, we want to make sure they understand how to provide care that is contextual, compassionate, person-centered. We want to make sure that they have understanding of how to integrate and incorporate behavioral strategies to help patients change behavior with regardless of what they're showing up with. And the last thing is how to do team-based care. Now, the future PCBH Corner will dive into how we do that, but those are our three things that we want to make sure that when residents leave our facilities, whenever residents leave our training program, that they are equipped to do.